of fact speech is going to be about drug use. And my major claim is drug decriminalization has a positive impact on society. Before I talk about it, I'm going to define society. Society is the aggregate of people living together in more or less an ordered community with public services funded by taxes. The major secondary claims I'll be talking about are the war on drugs as a product of drug criminalization that wastes resources that could be used for other avenues to benefit society. My second claim is Portugal, a country that has decriminalized drugs, has created a better health system for its society. My third claim is criminalization of drugs contributes to drug use. So going back to the first point, my subpoint A, the war on drugs is a failure. A study done by 6 researchers called the Temporal Relationship Between Drug Supply Indicators and an Audit of International Government Surveillance System uses international drug surveillance databases to assess the relationship between multiple long-term estimates of a legal drug price and purity. We can use this as an indicator to see if the war on drugs is working, because if the war on drugs was working, then prices of drugs would increase as it becomes scarcer, and so would purity as it becomes harder to attain. The problem is that the study, it showed that the inflation-adjusted price of heroin, cocaine, and cannabis decreased by 81 to 86% since the 1990s, and the purity increased by 60 to 161% since the 1990s. In conclusion, the research shows that the U.S.'s war on drugs is not leading to any type of success when it comes to removing drugs from the states, as purity and scarcity is not going anywhere. Point B, money is wasted when results are not there and could be funneled elsewhere. According to the National Drug Control Policy, the federal American government spent $15 billion on the war on drugs in 2010, with local governments adding another $25 million to that. This number has not gone down. It's added up to around $1 trillion since 1971, when President Richard Nixon declared the war on drugs. So point 2, Portugal is a country that has decriminalized drugs and created a better health system for its society. I'm going to use it kind of like a case study to compare everything I'm talking about. So incarceration is too costly when compared to treatment methods. Nuno Capes, who is on the Health Commission Board in Portugal and is responsible for helping administer the decriminalization policy, stated in an interview that it's cheaper to treat people than to incarcerate them. Moreover, decriminalization freed up resources that could be channeled into treatment and other harm reduction programs. This is backed up by the National Drug Institute statistics showing that treating addiction in criminal justice system is cost effective. The cost of methadone treatment averages around $5,000 a year, compared to approximately $24,000 for state and federal prisons to keep people confined. Next point, instead of locking up drug users, they receive help and can live a productive lifestyle not hindered by drug abuse. Joe Goal, president of the Institute of Drugs and Drugs Addiction, stated that there is no doubt that the phenomenon of addiction is in decline in Portugal. He also went on to point out that drug decriminalization itself did not fix their problem. Decriminalization in conjunction with proper treatment and risk reduction policies helped pave way to one of the lowest drug-induced deaths between the ages of 15 to 64 in Europe, which is sourced by the European Monitoring Center for Drug and Drug Addiction. My third point, criminalization of drugs contributes to drug use. The biggest barrier between an addict and getting treatment is the fear of arrest. In its 1998 report, the Portuguese Commission recommended decriminalization as the optimal strategy for combating addiction problems. The Portuguese Commission had concluded that the stigma and burden of being convicted for a criminal offense had hindered the ability for the country to clean up their society drug abuse problem. João Castelo Branco Boalo, the chairman of Portugal's principal drug policy agency, the Institute on Drugs and Drug Addiction, emphasized that before the 2001 decriminalization law passed, his main challenge was drug addicts feared seeking treatment from state agencies offering it because they're afraid of being arrested. Because in most, especially in the US, just being on drugs, you're a criminal. And Portugal used to be like that, so nobody wanted to seek help when they were on drugs because they're a criminal. They're going to be arrested first and maybe treated if they have money. So it was counterproductive. Nobody wanted to get treated because they were both scared of being treated as a criminal. point B, decriminalization of drugs does not increase drug use when accurate information on drugs is readily available and taught in the school curriculum. In the context of these European Union-wide trends, usage rates in the post-decriminalized Portugal are notably low. As the 2006 report on Portugal drug policy concluded, 5 years after decriminalization, the prevalence of drugs in Portugal, both in general and the school population, is below the European Union average. Proper education teaches the societal youth the risks of drug abuse, and they have access to harm reduction services like clean needles, overdose prevention, access to treatment on demand. Thank you.
All right, Alejandro, the proposition's clearly identified. The preview is fine, except that your first point seems to have a justification built into the secondary claim. You probably want to simplify that, but the structure is going to be easy to follow. At least it appears that way at first. When you did get to the body of the speech, you actually have an A and a B point on that first point, and that was a little bit confusing because it sounded like maybe you had just shifted the organizational structure there because you didn't repeat what that first point was. However, the second and third points are labeled very clearly. So again, it's relatively clear to follow. You've got good evidence on Portugal and their experience. There are a couple of places where I think you need to talk about and find some evidence that is comparable for the U.S. For example, the one thing that you mentioned about being a criminal and seeking treatment in Portugal, just being on drugs was a criminal offense. That's not necessarily the case in the United States, and I think you need to find information that suggests that that's true, because that would then make your analogy a little bit more useful. As it is, I think that might be a situation where there is a difference. I thought you had a good explanation of the evidence on the first point, how we're supposed to be interpreting the effectiveness of the war on drugs using the purity and the cost issue. That's an interesting perspective that you've got there. There might be other measures of this as well. I'm not sure, by the way, I just thought about this, I'm not sure why you bothered defining what society was. I didn't think there was going to be a lot of confusion over that in your argument. Like I said, the evidence on the second and the third point on Portugal is pretty effective, and so you're going to be very dependent on that as an analogy for your argument. You need to do a better job of speaking to the audience. This is mostly public reading that we got in this presentation, and you need to engage us a little more. All right, thank you.